Well, it's a parent's nightmare, the baby that cries and cries and cries. Well, we're going to put an end to those late-night hours walking the floor because my next guest has a definite and quick way to stop a baby from crying. He calls it flipping the switch. Dr. Harvey Karp is a board-certified pediatrician, associate professor of pediatrics at UCLA Medical School, and author of 3 books and a video, including The Happiest Baby on the Block. Watch what he does with a crying baby that's just 3 days old.
50% of the babies in America cry or fuss for more than 2 hours a day. There are 5 ways of turning on a baby's calming reflex. They're called the 5 S's. The first S is swaddling, which means tight wrapping. I do what's called the do-do wrap, which stands for down, up, down, up. The first wrap of the blanket is down over the shoulder and around, so that first arm is snugly at the side. The next step is bringing the blanket up from the feet, and I tuck it over the shoulder. The third step is bringing the blanket over the other shoulder and just holding it right over the heart, like you're tying a package. And then up and across, that's the belt that holds it all together. Yo, and you come just with that. And if that doesn't calm him down, try the next S, the side or the stomach position. Put him on his side. Look, it worked right away. If he's still fussy, of course, you could try the third S, which is shushing. Okay.
That's the noise.
You shush as loud as he's crying.
How long will that work?
Forever. The fourth is swinging. So it's a little tiny jiggly motion of the head. It's not a big movement, it's just a little jiggle. And if he's still crying after all of that, try the fifth S, which is sucking. You can use a pacifier or your finger or put your breast in his mouth. Any of those can turn on the calming reflex.
Let me ask you about the shushing. One of the things I've always said to parents is that we have to remember that kids join our life, we don't join theirs. And so when we brought Jay home for the first time, I play music in the house all the time. And my mother was, the baby's sleeping, turn the music down. And I said, no, the baby will learn to adapt to the music. Isn't it awful noisy in the womb?
Well, that's exactly what it is. It's louder than a vacuum cleaner, 24/7. So they're hearing the sound of the blood flow. So the idea that we take them into our house and everybody's tiptoeing around and being super quiet, it's bizarre for babies. They're missing that hypnotic, rhythmic noise.
All right, so that's why you were up in his ear like a vacuum cleaner.
Right, because
really
if you're not as loud as he's crying, he doesn't even know you're there.
All right, well, what are you've got myths that you talk about. Tell me what they are. What's the first one?
The first myth is that they're ready to be born after 9 months. I mean, every woman is ready to have her baby after 9 months. But babies are not like horses. You know, I don't need to tell you, but a horse is ready to run the first day of life. They're ready for the world. Our babies are fetuses for the first 2 to 3 months. They're not ready until 3 months when they're smiling, cooing, and ready to do this interaction stuff. But, you know, they have to be born because their heads are so big. It's not really an option, right? No, it's no option at all.
I mean, we got to have them. You just wish they could stay 3 months longer.
No, I don't want them to be in 3 months longer. But what a parent has to understand is for those first 3 months, they're like one big walking uterus. When you drive your baby around in your Buick is an imitation of the uterus. Babies need that rhythmic calming to turn on this calming reflex.
Okay, so your Buick is a uterus. I got that one. All right. And what's the next big one?
The next big one is that women or parents know what they're doing from the beginning. It is intuitive to want to calm your baby. It is not at all intuitive to know how. That's a skill. It's not a hard skill, but it's something that requires training.
And so we covered the 5 things. Now,
but there's a key to the 5 things, which is that all of this is based on a reflex called the calming reflex. Well, that's, as you said, it's the off switch for crying. But any reflex has got to be done exactly right for it to work. If you hit somebody's knee and you're off by an inch, nothing happens. If you hit it in the right place hard enough, boom, it'll happen 1,000 times in a row. So with the calming reflex, you've got to know the 5 S's, but you got to do them exactly right. If the wrapping is too loose, it'll make them cry more. If the shushing isn't loud enough, they don't even know you're there. So it's doing them and doing them correctly.
And so you can dial that in, right? I mean, you learn to do that as you're...
Right, with some practice.
Yeah, so you just wrap a little tighter, and you do it a little at a time as you're wrapping tighter. All right, and babies don't cry because of gas, right?
No, that's another big myth. Yeah, I mean, sometimes they have a little gas that triggers the crying, that gets them rolling, but they don't go on and on and on because of that. And you know it couldn't be gas because, again, if you take them out in the car for a car ride and they quiet, and then they start crying when you get to a red light, I mean, red lights don't make your stomachs hurt, you know what I mean?
Yeah.
So pain wouldn't come and go like that. Pain wouldn't go away when you turn on a hairdryer. And yet that loud noise is so calming for babies.
Do you have to do the 5 S's in your lap?
You do it anywhere you want to.
Okay, so it works.
Lap, you can put them in a little bassinet and jiggle them. Swings are great. Swings are a big help.
All right. And now, if these things don't work, if you're doing them right and they don't work, it's time to call you, right? Time to call their pediatrician?
Yeah, they should call for help. But most of the time when they don't work, it's because they're not being done right.
Yeah.
And so that's really the first step. And let me tell you, as you all know, I mean, it's tough enough having 5 babies at home, but one crying baby, it's really demoralizing. And it can lead to depression. It could lead to child abuse.
Yeah, that's the #1 factor in postpartum depression, right?
You're exactly right. And in shaken baby syndrome, crying babies, #1.
Yeah, sure. Well, we want all of y'all to know how to do this. So the good news is, under everybody's chair is the videotape, The Happiest Baby on the Block from Dr. Karp. You all get one to take home. All right? We'll be right back. Great job. Thanks. Thanks. That's amazing.
It is the most fun.